We're up to 8,658 new cases. Overall, we have 130,000 people who tested positive, 16,000 people in our hospital system, 13,000 people have been discharged. Number of deaths are up once again. Number of people we lost, number of New Yorkers, 4,758, which is up from 159, but which is effectively flat for 2 days. While none of this is good news, the possible flattening of the curve is better than the increases that we have seen. New York is still far and away the most impacted state. New Jersey is having real difficulty, and been speaking with Governor Murphy from New Jersey, and anything we can do together, we will. Michigan also. California has leveled off, and Louisiana is having a difficult time, so they're in our thoughts and prayers. Total number of hospitalizations are down. The ICU admissions are down, and the daily intubations are down. Those are all good signs, and again would suggest a possible flattening of the curve. The number of discharged is down, but that reflects the overall reduction in the numbers. Big question that we're looking at now is what is the curve? And we've been talking about cases increase until they don't. When they stop increasing, then what happens? And the projection models have a number of alternatives. Some suggest basically the curve goes up and then drops precipitously. Some suggest there's a slight pause at the top. Some suggest there's a longer pause at the top, which is effectively a plateau effect. Or again, the straight up and straight down precipitous drop, which is the peak effect. No one can tell you which will occur. They say any one of the three options. You study other countries, you've had a combination of the above. We are studying it as we have used the projection models from day one to determine actually what we do. How do we set policy and program? By following the data. Dr. Malatras has been working on the numbers, working with the statisticians and the projection models, and helping us incorporate that into an operational model. And Jim, if you want to just take a moment and speak about the projection models here, please.
Great. Thank you, Governor. As the Governor said, we have been looking at projection models from the beginning to determine the size and scope and severity, and the Governor has mentioned this over his briefings. We've been working with many organizations and using their data like Imperial College, the Institute for Health Metrics and Evaluation, Cornell, McKinsey, and others. And some of the initial projections that we first saw at the beginning of this was at least 100, up to 110,000 beds for COVID patients alone. And the peak would come at the end of April. Those were some of the earliest modeling from many organizations that it would be at the end of April, around 110,000 beds just for COVID patients. There are other models, too, that we were tracking, one being lower at about 55,000 COVID beds, but again, peaking at the end of April. We follow now that we have a pretty robust data set to go by for the last several weeks. The bottom line there, the purple line, is sort of where we are tracking today, which suggests it's a little lower. And the question was, what could you do to lower those initial projections from 110,000 and from 55,000? So a lot of the activity was, we saw where the statisticians and the folks looking at these types of models said it was going. So what activities and actions could you take to aggressively lower that overall number? And the answer really was, and what the governor has been doing, was aggressively enforce and enact social distancing to lower the overall number. And this number and the current data suggest that that is exactly what's happening. And it's not settled yet because we are going day by day, and the numbers, as the governor says, has changed a lot over the time based on what numbers come in. But this could suggest that we are indeed potentially at the apex, or beginning to be at the apex at this moment. Like the governor has said, there's been a range of models: 7 days, 14 days, 21 days, 30 days. It looks like we're towards the earlier side of that time frame based on the current projections and modeling that we've been looking at.
Thank you, Jim. But you also see on these, you see on this slide where we are now, right? And it can still go any way. We could still see an increase. So it is hopeful, but it's also inconclusive, and it still depends on what we do, right? These models all have a coefficient of what we do and how successful we are at social distancing, et cetera. And from our decision-making point of view, it doesn't really matter if we've hit the plateau or not, because you have to do the same thing. If we are plateauing at a very high level, and there's tremendous stress on the healthcare system. And to say to this healthcare system, which is at maximum capacity today, right? This is a hospital system where we have our foot to the floor and the engine is at red line, and you can't go any faster. And by the way, you can't stay at red line for any period of time, because the system will blow. And that's where we are. We are at red line. People can't work any harder. The staff can't work any harder. And staying at this level is problematic. And if we are plateauing, it's because social distancing is working. So we have to make sure the social distancing actually continues. On the relieving the pressure on the hospital system, which is unsustainable at this rate, we're continuing what we call our Surge and Flex program, where we get all the hospitals on the line on a daily basis. They're all doing inventories. They're all doing data sheets. They're all on the telephone, and we're shifting among the hospitals, ventilators, PPE equipment, who has gowns, who has masks, and that happens on a daily basis, that adjustment. Also, to relieve pressure on the hospital system, the Javits coming online is a very big deal. That is the relief valve for the entire downstate system. The 1,100 military personnel started to come in. 300 were sent to New York City public hospitals to help the New York City public hospital system, the H&H system, which has been under stress. The rest will be going to Javits to bring that up and running to full capacity. That transition is happening now. That is a COVID center now, started as non-COVID. It's now a COVID center. The majority of the military personnel will be coming in tomorrow and the next day, but that Javits center is going to be a major relief valve. Second, the United States Navy ship Comfort. The original plan was that would come in for non-COVID people. The original plan was it would also be a relief valve on the hospitals, but not for COVID people, that it would take all the non-COVID patients, if you will, from the hospital system. That was the plan. As it turned out, there's not a lot of non-COVID people in the hospital system, which is a separate story, happens to be a good news story. A byproduct of shutting everything down is you have fewer car accidents, crime rate is way down, fewer trauma cases, so there is not a large non-COVID population in the hospitals. I'm going to call the president this afternoon and ask him to shift the Comfort from non-COVID to COVID. Then we would have...
All right, what you were listening to just now was the daily press conference by New York Governor Andrew Cuomo.